not very good at this, but I've decided to start a YouTube channel. I've been trying to do it for ages, just either lost the confidence or the motivation or something's come up. But I feel like now's the right time. I'm tired of trying to recover from my mental health problems whilst not being honest with myself or anyone around me with what's actually going on, which is completely counterproductive. So I just thought I would kind of express myself the only way I know how to, and try and talk and connect with people and advocate and just get out there. I think the last decade's taught me a lot. I started off the last decade in a psychiatric unit, seeing in 2010 in a hospital bed on one-to-one support, essentially. And I thought I was getting better, and then I got a lot worse. And this year's been the hardest year I've ever had. And I've only just learnt to really talk about it. So yeah, I don't really know what to do, really. So for those of you who don't know me, and I hope will get to know me, my name's Maddie. I'm 23. I'm a graduate in psychology. University was never ever an option for me until one of my teachers in college told me if I get my act together, then I could go into psychology like I wanted to and actually have a degree behind me. And 4 years later I got a first class honours, and am now a qualified psychologist working in mental health. I also have OCD and bipolar, potentially borderline personality disorder, and it has taken me 10 years to get past assessments and get service help, really. I've had to fight for so long, and it's one of the reasons why I went into the field, because I didn't like the way people had to fight and essentially prove that they're ill, when all you want to do is get better. And yeah, so my main goal, I've always wanted to be a mental health advocate. It's what I wanted to do when I was first in hospital at the age of 13, and you don't need a degree to be an advocate. One of the reasons why I didn't think about going to university either, but then I decided that I wanted, although I knew I was passionate enough to be in mental health and I had my own personal experiences, good and bad, especially being through CAMS. I'm sure a lot of you know how up and down it can be. But yeah, I just decided that I just wanted to have that degree level theory behind me so that I had a leg to stand on when I was fighting against people. Personal experiences are everything. If you can back it up with research, there's not much to argue against, really. So I kind of went in that avenue, and I've just recently published my first article in the Journal of Mental Health and Social Inclusion about my experiences and experiences of other service users and how we can fight kind of with the NHS and work with them to provide that level of recovery support that we all need and deserve, if anything. So yeah, I don't want to talk too much obviously in this video. It's just a little video to kind of say hi, and I've already really been talking for about 5 minutes, and I have no idea what I'm saying. So yeah, I think I just want to leave it at that, and this channel is literally going to be about my struggles, my ups. You know, we have good times too. I want us to laugh together, cry together, get furious together. You know, I want to be able to connect with people. I want to be able to show that, as cliche as it is, you can get through this. I didn't think that I could get through 2019. I got to the lowest point I've ever got. I was with home-based treatment teams for most of the year, crisis management, hospital admissions to like A&E and stuff. So it was really difficult. But here I am, sat in 2020, and no, a year doesn't, like, just because the date's changed, it doesn't mean your mood changes, but it's another day to live, and it's another day to just be there, and feel everything, and accept how you're feeling, and figure it out over time. So yeah, this channel is going to be about my struggles, my ups, my downs, my experiences, past and present, and also I want to do kind of like some professional things as well, like resource videos and yeah, anything that can help. And you know, I'm just starting out. Hopefully I can get some of you on board, following and being there, and I really hope this year I can kind of connect with you and just be able to help in any way possible. So yeah, I will be uploading my next video over the next couple of days. It will be a video on just who I am, really, like an overview of the experiences that I've had so far, like my mental health journey. I'm not going to make it too long though, it'll just be brief at this stage. And if you guys want anything in particular, then give me a message, or comment or anything like that. So yeah, thanks guys.